Hi, I'm Dr. Blanche Grube, and I would like to give you an introduction to biological dentistry and medicine. A similar term was coined first by Dr. Al Fonder when he wrote the book The Dental Physician. It's a must-reading for anybody who's interested in biological dentistry. Years later, Dr. Hal Huggins said that he thought the dentist was the primary care physician because more people go to the dentist more often than they ever do the physician. That's reason number one. Reason number two is that the dentist has the opportunity to actually look inside the mouth, and the conditions of the mouth very often tell what kind of condition the rest of the body is in. So I like that term, the primary health care provider. But today, I think it takes more of an integrated approach. It takes more than one physician, one dentist, or any one practitioner to come up with the right diagnosis for a patient and to come up with the right treatment. It takes an integrated approach. What do I mean by integrated approach? Well, there are many different modalities. Some of them come from Eastern medicine, some of them come from Western medicine, and we'd like to incorporate all of them together to come up with the right diagnosis and the right treatment. Let me give you an example. When a dentist does an examination, we usually look at a health history, we look at a symptom survey, and then after that we take x-rays and do the examination. And with those four things in mind, we come up with a diagnosis. Well, in biological dentistry, you can add different modalities to your examination and get a better picture of what's going on with the whole patient. What kind of constitution do they have? How strong are they? How weak are they? Are they going to be able to handle the dental treatment? So you could add things like electroacupuncture by Vol, where the energy patterns in the body's meridians are tested to see if they're strong or weak. You could add muscle testing to determine which organs are functioning well, which ones are not functioning, which ones have blockages. Autonomic response testing was something that was brought to the United States by a German physician named Dietrich Klinghardt. You get a tremendous amount of information about the body from autonomic response testing. So muscle testing, EAV testing, iridology, these are all things that you can incorporate into your examination, get a better idea of what's going on with the whole person. In biological medicine, those same modalities are added to help the physician determine what the real problem is. Not just the symptom, but what is the real cause of the patient's problem that are causing the symptoms. When it comes to treatment, dentists are all very well versed in how to do good fillings, how to do good crowns, how to do orthodontic treatment, periodontal treatment. We all do that very well. In biological dentistry, other modalities are added to that very same treatment. We can add acupuncture, homeopathy. You do a tremendous service to a patient if you can give them a homeopathic remedy after surgery rather than give them a prescription drug. Herbs are used quite often. Nutrition, supplementation. We go over diet very carefully in biological dentistry. When I went to dental school, the definition of a good dentist was one that could do a filling or a crown that lasted forever. Great! Now my paradigm shift is such that I want the patient to last forever. Of course, nobody lasts forever, but if I can add a few more good years to this patient's life, then I have succeeded, and I feel very good about that. I love the paradigm shift. I love being able to treat the whole patient and not just look at their mouth and do repair work on teeth and do fillings, crowns, and maybe a little orthodontic work. It's much more rewarding now. If you'd like to learn more about biological dentistry and medicine, please check out our website at www.iabdm.org. That's the International Academy of Biological Dentistry and Medicine. We have members from all over the world. We meet in all different places. In fact, I think I have more friends in the academy than I do in my own neighborhood. It's a great organization. It's a great way to expand your practice, to learn how to treat the whole patient. I'm Dr. Blanche Grube. Thank you for your attention.